Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Mealy, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Welcome to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Mealy. Happy to be talking to, I won't call him an old friend, but a good friend who I've known for the last decade through EMS experiences. His name is Shane Spielvogel. He's the Executive Director of North Huntingdon EMS. Shane, I'm really thankful that you took the time to talk with us because I know what a challenging time it is to be in your line of work during COVID-19. So thank you so much for joining us.
Thank you for having me. I'm glad to be here and be able to talk to everybody today about what's happening in EMS.
Great. So let's start with North Huntingdon EMS, also known locally as Rescue 8. Of course, people in the community know it, a long-time service in the North Huntingdon Township community. So why don't you tell us about the organization? How big is it now? What kind of services are you providing?
Sure. North Huntingdon EMS Rescue. Yeah, you're right. A lot of us locals still call it Rescue 8, but started about 65 years ago as a volunteer organization formed out of the 7 fire companies. So we were the 8th entity in the township. That's how we became Rescue 8. Formed to be able to take sick and injured people from the township to local hospitals for treatment. Now, remember, this was many, many years ago before the advent of where we are today with pre-hospital medicine. And it really was one of the local stanchions of pre-hospital care in Westmoreland County. One of the first established, one of the most advanced for their time. And through the years, it's evolved from a purely volunteer organization. We are now a primarily career organization with some volunteers still here. Today, we are the EMS provider for North Huntingdon Township, which is 32 square miles and approaching around 37,000 residents, but obviously a lot of visitors to where we are. We have a full-time staff of 17 EMS providers, another probably 15 or so part-time casual EMS providers, and a cadre of volunteers that are associated with us in several ways. Some of them are people in other careers who are looking to still use their EMS credentials. Others are members of the community who are thinking about careers in EMS or healthcare. And they're using Rescue 8 or North Huntingdon EMS Rescue as a springboard to see how that would go. Some of the services that we provide, obviously, we provide emergency ambulance service to the residents and visitors to the township, as well as we are a state certified heavy rescue company. We are a state certified swiftwater rescue team. We have a community paramedicine program that handles everything from vaccinations for shut-in persons in their residences of the school district, actually. We do car seat installations. We have car seat technicians that are here to make sure that the little ones are properly secured, CPR and first aid training. And then we also do various community events such as immunizations and supporting clinics like that. So a lot happening here at North Huntingdon EMS, probably a lot more than a lot of the residents even realize.
I think you're right. I agree. But I see you guys everywhere being a North Huntingdon resident. So I see you, it's like I used to joke about the Medcare equipment company trucks. Like once you see one, you'll see 1,000 of them. And that's how North Huntingdon EMS is. And it's a large community. So what made you get into this line of work? Where did you grow up? What's your education, your experience?
Sure. So I was a graduate of East Allegheny High School in North Versailles. Grew up in Wilmerding, born and raised. And after high school, went to the University of Pittsburgh, where I received my bachelor's in nursing. During college, I started to work for UPMC as a nurse tech. And once I received my nursing degree, I worked with UPMC full-time for about 18 years in a variety of roles. That included a cardiac ICU nurse. I was a cath lab nurse. I was an emergency nurse and assistant director. I did 4 4 years as a flight nurse on stat medevac for helicopters and planes. I did a little stint in corporate legal and risk, which was very interesting, a different way of thinking about things. And then an EMS liaison. And during all that time, since I had been 16 years old, I was a member of a volunteer fire and rescue agency. So while I was doing all my nurse training and the specialty things that go with that, I was also doing a lot of the fire rescue training that included structural firefighting, rope rescue, vehicle rescue, water rescue, collapsed building rescue. And in the spring of 2013, this opportunity presented itself, and with the encouragement of some friends, I applied to this position at North Huntington, went through the process, and was lucky enough to be awarded the position. I've been here since June of 2013, so just a little over 8 years. And it's been very good. So I get to apply the knowledge of the nursing background, the rescue background. I work with a great group of individuals here who really kind of make my job easy. They carry out the mission very well. And, it's good to work with a great support staff. So that's kind of how I landed here. I have an unusual nursing trajectory. I joke, I haven't worn scrubs since 2003. But, I'm still a nurse. I still practice, still take care of sick and injured. And here we are.
Now, a lot of what you do has changed since
Yes.
March of 2020. So let's do sort of a timeline check here. Let's go back to January and February of 2020, where you're hearing rumbles of this virus that is supposedly, perhaps made its way to Portland and, perhaps could make its way out here. Were you getting word about this? Were people talking, or was it still sort of mysterious back then?
It was mysterious to us. So we started, a lot of us here are news hounds. We kind of watch the world events for things that are emerging all the time in a variety of ways. And I remember watching a news story about the Chinese government had barricaded a city that had an infection rate. And about 3 weeks later, I was invited to a meeting at a local hospital system to discuss potential changes that might be coming in response to this virus. And I knew that it was serious when the physician who was leading the discussion walked in and closed the door behind him. And then walked the door behind him and handed out hand sanitizers. And I thought, well, this is kind of interesting. And he said, prepare for life to change. Prepare for things to be different in 2 weeks than they are today. And in 6 months, we don't know where we're going to be.
Wow.
And
very prophetic, huh? So prophetic.
Yes. How accurate that was. And what EMS was prepared for in the beginning was nothing about what happened. You talk about that first quarter of 20, March, April, especially, we were in the EMS and healthcare really preparing to be bombarded with very sick individuals, along with planning for losing staff for periods of time due to quarantine and sickness. And I'll tell you that in that first 6 weeks, 8 weeks that we really started to take off with this, we didn't experience that. It went the other direction. Our call volume, Jen, we handle on a 24-hour shift. We'll do about 18 to 20 EMS incidents on a 24-hour shift. That's our normal. During those times, we had dropped all the way down to 3 or 4.
Wow.
And this massive curve that we expected never came.
Well, and this prevention, I assume that was people staying home and
a lot of
going anywhere.
And
right.
People took staying home to a new level where they just didn't even go seek care if they were sick. So, it eventually kind of evened back out in the spring and summer. But for a long time, our call volume had really dropped out. And so, which was okay because we had challenges with securing protective gear for our staff. We had,
I remember. Yes.
People were donating. Like we had businesses that had closed that worked in even the ancillary healthcare, industry were sending us masks and gloves. A nail salon in North Huntington Township called and said, "Hey, listen, we have cases of masks that we can't use because we're not allowed to be open. Do you want them?" And so we had no idea where we're going to be. And I'll be honest with you, even as I sit here today, I couldn't have predicted where we are right now 6 months ago. And I don't know that I can predict what's going to happen in 6 more.
I agree. So then you get to spring and summer, call volume stabilizes, but then the weather turns in 2020.
Yes.
People head inside.
Yes.
Huge spike in coronavirus cases. What is it like at that point? Because, no vaccine available at that point, right?
Mm-hmm.
Mask fatigue, people trying to return to normal, hoping that it's over, but it wasn't.
Yes. And so we were seeing it in a variety of settings. We had congregate care areas like nursing homes and personal care homes that were having an outbreak within their walls. And that's what's going to happen. It was close quarters kinds of, already people with comorbidities and health risks. And so we had that setting where we kind of expected it to happen. We had the residential settings where one family member maybe gets sick and because they are contagious but don't feel any symptoms for a couple of days and they're home with their family and just doing normal family things, the whole family gets it. And so now, we were dealing with it in a variety of locations. And then we also service physician offices, and there are some quick care centers here in the township that we deal with. So everything started to come back to us. And so, yes, now EMS crews are really out there in the front lines. I mean, the hospitals, healthcare system as a whole was really starting to feel the strain, and EMS is feeling that so much more. In a hospital environment, there's some control to the chaos. You can kind of contain it. But in the residences, I mean, it's just you and your partner, and you're wearing these full face masks or these P100 masks that fit very tight to your face with very thick filters, a gown, gloves, eye protection. We're used to dealing with infectious disease problems, but this was another level of
a whole nother level. And so that PPP that you were wearing, that the staff was wearing, did that prove to be effective?
It did. So we did have some staff members here who became ill before the vaccine was available, or at least became they had symptoms. They tested positive. They were off for 10 days or so, and then they all came back, and luckily they're all healthy today. But it did, it took its toll on, you talk about mask fatigue, right? So you talk about folks who are, I'm tired of wearing this mask to the store when I leave or doing this. Now imagine doing intensive patient care inside, outside, in all weather conditions and having to wear this mask. And then on top of that, you're worried that, okay, I've spent, my crews work a 24-hour shift, 2 days a week. So you spend 24 hours, and most of us do a uniform change night versus day, especially during this infectious disease time. Most crew members will shower and change uniforms mid-shift. But you don't want to take these things home to your family. So now you're worried, is it on my jacket? Is it? So, you hear stories about you bypass your family and go straight and decontaminate at home. It's just the things that we've been, the ways that we've adapted to this are just so wide and varied. And then, the advent of the vaccine comes around. EMS and healthcare workers, we are lucky that we were able to get in there very early to get it. The majority of our staff who wanted the vaccine was able to get it before Christmas of 20. I received my first dose Christmas week of 2020. And it's been really great for us. It's a little bit of a better layer of protection, a little bit more peace of mind, that you feel like I have a little bit more armor. I have a little bit more to keep it between me and them.
You're listening to Westmoreland Community Connections on WHJB. I'm talking today to Shane Spielvogel. He is the executive director of North Huntingdon EMS Rescue. Great conversation today about COVID-19 and the impact it's had on the local healthcare community. Stay with us. We'll be right back.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Welcome back to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Mealy. I'm talking today to Shane Spielvogel. He's the executive director of North Huntingdon EMS Rescue, and we've been walking through the challenges that his team has faced with COVID-19. And you were just talking about the vaccine being available to healthcare workers in that December-January window of December 2020, January 2021. Were you surprised that it took until October of 2021 to see that benchmark hit of 70% of the adult population in Pennsylvania getting their vaccine? So it took that full 10 months to get to that benchmark.
I was a little bit surprised. You know, in the very beginning, the vaccine was not readily available and widespread.
Right. For months, really. I mean, actually, for months. Yeah, I guess you're right.
My parents spent a lot of time on various websites refreshing, trying to get an appointment. We had become a primary vaccination site here at North Huntingdon EMS through the Commonwealth, which is not an easy thing to do, to be able to actually sign up. We went through all the hoops. We were able to order our own vaccine, had to order freezers and things. But then we were able to partner with some commercial pharmacies and support their clinics in the community. And we thought that was a better route. But absolutely, the benchmark at 10 months, the initial rush to get the vaccine, the people who sought it out and spent their time on various websites and on phone calls and, looking for clinics to go and get it. I call that the first wave. Those are the folks who wanted it, who saw value in it and wanted to get that vaccine. And then the rest were kind of like the willing. And then like the third wave is now, the folks who have to be persuaded for one reason or another. And I am a little bit disappointed that it took 10 months, but I understand the reasons why there's some hesitancy in some folks. And it's my wish that as many people as possible would get that vaccine, just because it gives us the best first chance to get back to any sense of normalcy. And so we encourage it. We continue to support clinics as they occur in our local area. And we want to see that number just continue to go up, especially now with boosters and with, children over the age of 5 being able to be vaccinated. That's a huge step to get back to schools, having some sense of normalcy for children. My 2 daughters received their first dose last Friday. So they were excited to get it. We were excited they were able to get it. And we want to keep pushing that forward to get as many people vaccinated as possible.
What is the situation now with employees? And I ask that because I see so many employers struggling to get people to come to work, let alone healthcare organizations where you're literally on the front line every day, going into homes of people with COVID pneumonia and trying to get them help and get them to the hospital. So how is your staffing and how are you working that out?
We're lucky. So the vast majority of our staff have taken the vaccine. And so we have, knock on wood, been very lucky with our staffing. Our numbers have not dropped, but we do see that in other organizations and some of the local hospitals. There's a exposure repeatedly to COVID vaccine, even with the most careful person, the most carefully vaccinated person. You could still become ill. You could still become COVID positive and have some symptomology and need some time off. we've seen it. We're okay here. We realize that employees have a choice about what to do with their own body about vaccination status.
Absolutely, yes.
The challenge is meshing that up with the requirements of employers to be able to persuade those staff members to be able to become vaccinated.
That's the cliff. That's the cliff that these hospital systems are facing, right? I mean,
yes.
that's the cliff.
Well, there's also the federal mandate. So, which they're holding off on right now because I think they see the challenges that may be coming from it. But I think it's a real issue that's going to become more of one probably in the next month, 6 weeks, as we see the mandates, either come back or come fully around, and then those deadline dates start to approach. What happens then? Who breaks first? Does the employee who really needs that position finally acquiesce and take the vaccine? Do the employers who just need staff decide that the mandate to them is mandating vaccinations is not as important as keeping the doors open? And that applies to everything, right? So healthcare is absolutely a vital service, but so are grocery stores, so are retail outlets, so are, other essential day-to-day things that everyone relies on. And you're absolutely right. Employers are having a hard time right now even getting anybody in the door, before we even start talking about any other problems with vaccinations or any other mandates that come along with it.
Interesting. Now, your revenue, I'm sure, was impacted by COVID-19. If you're going from, an average of 20 transports down to a handful, 3 or 4, right, it becomes critical because, your revenue is based on the insurers paying you for the work that you do. So it's a sort of an eat what you kill scenario, right? And, that's why I wanted to kind of talk a little bit about funding and that community funding and where your funds come from and how important it is to become a member of not just North Huntington EMS, but all ambulance services and how they rely on that. So why don't you talk to the people who are listening now about how critical that membership really is?
Yeah, it's incredibly important. So every EMS agency right now relies primarily on their revenue stream, which is done through transported patients. There's an incident, somebody dials 911, an ambulance comes, and when that person is transported to the hospital, the revenue, the bill through insurance is generated through that. If there is an ambulance call and nobody's taken to the hospital, that ambulance does not generate typically any kind of an invoice or a bill for that patient. So there's no revenue for that. And even once a person is transported, all EMS providers typically have contracts or some agreement with various insurers that end up reducing the overall money that will be brought in from that transfer. So subscribing to your local EMS agency is important. That for us in North Huntington, we mail out every March. It's now approaching 19,000 mailers. We send one to every address in the township, businesses and residentials and everything. And as our township continues to grow, so does our mailing list. I think you'd be interested to know that we have about a 23% return rate on the ones that we send out. So, only 23% or so of our township residents give to the subscription program, which for us does have some benefits, meaning like a reduction on invoices, balances that are coming through. We do some things like that and some other small benefits. But those generous donations, which are tax deductible and important to us, they make us whole, right? So they fill the gap between the billed revenue from ambulance transfers and where our budget is or where we want to be for our budget. As a nonprofit, we're responsible to keep putting money back into the agency to make us better and stronger. We are not just kind of squirreling money away. And the North Huntington residents have been very generous to us. And so we are lucky that we get the support that we do But I know in other parts of Westmoreland County and wherever people are listening to this, their local agency is also looking for that same support. And so wherever you are, I think it'd be a great idea to look into your local EMS and maybe ask them if they have a subscription drive and what is included if that person were to become a member. It's something that we hope you never have to use. We're thankful for the donation. We hope you never actually have to call for us and use any of those discounts or other favorable things that come out of it. But that's where it is today. When you get that fund drive mailer or you receive the notice one way or another, please don't just discard it. We need everyone's help to get through this. We would have never gotten through those low revenue times in early 20, and by the time our billing even caught up, remember the billing cycle takes 30 to 45 days. Mm-hmm. So even once our call volume came back up out of the basement, it still took 30 a month and a half to be able to get those revenues coming back in. And so
true. And those, the ambulances aren't cheap, are they? I mean, the training isn't cheap. If you want your community to have the best, there's an investment that comes into that. I mean, one ambulance, hundreds of thousands of dollars.
Yeah, our ambulances here, the way that we purchase and equip them, they're about $160,000 a piece. And that's before you put anything else into them. That's just a truck and a chassis, and then you've got to build it out from there.
Right, and you never know how important that is until your life's on the line, do you?
No, and it's one of those things that you never think about until you need it. But the moment that you do, you're thankful that it's there and it functions the way that it's supposed to.
Absolutely. And so your mailer comes out 23% return rate. And it's funny, as a marketing person myself, you say, oh, only. And I'm thinking, well, that's really good. That's really good conversion rate. But I suppose, getting the message out, that's always critically important, that people know about that. And I have been there for my flu shot, many flu shots. I've been there, and I think it's just such a valuable resource to the community. Also, the building has to be maintained, right? I mean, there's right. Expenses that come with that as well.
Yeah, our Rescue 8 station on Center Highway, which is right next to the township building for North Huntington, is a large building. It's 3 floors. I mean, the staff lives here. It's a 24/7 operation. Sure. And so, like this coming calendar year for our budget, we've built in some remodeling because, the building is like all buildings, all homes. This is our home. Sometimes need updates. Things wear out or change, or we grow. We didn't have the staffing here 10 years ago that we do today. Mm-hmm. It wasn't necessary.
Sure.
But as we continue the township grows, our call volume grows, the programs and service lines that we offer grow, the needs of the station change. And so we're just trying to keep up with that. We've had the benefit of some like Eagle Scout projects that have really helped us out. Some local contractors have donated some things that we've had done, but it's a large building and takes some pretty good capital to keep it going.
It also takes pretty good leadership, and that is you. Shane Spielvogel is the Executive Director of North Huntington EMS Rescue. Thank you so much for being on the show today.
That was great. Thank you for having me. I enjoyed it.
You're listening to Westmoreland Community Connections on WHJB.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.